A very good morning, friends. This is Dr. Danny Devasi from Ayurveda. I was just seeing a patient who is hypertensive, who is having sleep problems, extremely stressed out individual. So he was asking me, Doctor, I am taking a lot of medication. I am taking high blood pressure medicine. I am also on anti-diabetic medication. Do you have anything in Ayurveda which has a natural solution, of course, and I don't want to take any further medications, whether it is Ayurveda, whether it is homeopathy, anything. I said, why not? Yes, it is. You have to make a very, very right choice of your diet and lifestyle changes. That is number one. And as an Ayurveda support, what we can extend is an Ayurveda Abhyangam, or which we call it as an Ayurveda full body oil massage. Friends, a lot of people ask me what happens in a massage. So we have to understand the physiology of a massage. Okay, what happens in Ayurveda massage? First of all, we are all living in a very stressful environment, job stress, relationship stress, a lot of other exigencies that we are following day in and day out. So our body is always on a sympathetic tone. We have two different type of nervous system, which is there in the autonomic nervous system. We have sympathetic nervous system and a parasympathetic nervous system. Easy to understand. See, sympathetic nervous system doesn't make you sympathizes with you. It actually excites you. It's just the opposite. What sympathetic nervous system does is, it increases the heart rate, increases the breathing, it increases the sweating, it actually makes you stressed out, or palpitation. All those things comes by the sympathetic nervous system. The parasympathetic nervous system is actually a healing by nature. It actually relaxes you. It calms down your brain waves. It calms down your heart rate. It calms down your respiratory rate. And of course, it makes you relaxed. So what happens in a massage when we actually smear the oil? So what happens at that particular point? All our pores of the body get jammed, because skin is the largest organ in the body. So when we apply oil or serum, we do it with serum, very, very effective serum. So when we do with that particular serum, the pores get jammed. Once the pores get jammed, the body traps the heat. The heat is getting trapped. The skin is unable to breathe. So at that point, what happens? It's like all happening in a cascading effect. So heat is getting trapped. Body is getting confused. So body is actually sending signals to the brain that there is something here which is stopping the transfer of heat. Immediately, the autonomic nervous system will actually go and squeeze the sweat glands. That's the reason after an oil massage, we feel sweaty. And the second thing is that once you start sweating, then there is also compression and relaxation. The therapist will come, and if there are definitive strokes on the body to relax, there will be some kneading kind of a thing or cupping. Those are the various type of strokes that the therapist will be doing. And this will help the body to go in a state of compression, relaxation. So what happens? This excitation, relaxation, we have a tone, or a sympathetic, parasympathetic tone is set. That means the sympathetic tone comes down, the parasympathetic, which is the relaxing tone, comes up, and we end up in a state of equilibrium. That is the reason after a massage you feel sleepy or you feel relaxed. So it is always good to have an Abhyangam. How often you should be having it? It is absolutely up to you. You can do it once a week. You can do it once in 15 days, or at least once a month. Please do try it once a month. When is to go to any center, which is nearby you. Or the best you can do is, on a weekly basis, you take any oil and you smear it in your body. In ancient days, older days, our parents used to do it, and they used to make us, at least once a week, we used to have an oil bath or a massage, smear oil. We used to run around as kids, and then we were asked to take a bath after that particular half an hour, 40 minutes. It is very, very relaxing. I must recommend this therapy, this technique to all of you. Please do it. Please do try it at home. I am very sure that you will be reducing your cortisol level by over 30%. Sleep will improve by minimum 60%. And of course, if you are hypertensive, your blood pressure will come down by 10 to 15% points. So with this, I leave it to you, and we'll be seeing you with newer topics, with newer explanation. Thank you so much. Share this video to your friends who would be requiring it, and for any sort of suggestions, you are all the more welcome to come to us. We'll be more than happy to help you. Thank you so much. God bless you all.